Hi everyone, I'm going to be discussing the paper that I submitted about opioid abuse. So the opioid epidemic has had a significant impact on the United States. According to the CDC, it is estimated that opioid abuse costs the United States about $78.5 billion annually. This number reflects healthcare costs, the loss of productivity, addiction treatment, and the cost for the criminal justice system. I chose this article to speak about because the numbers in the article were so alarming, and the facts related to as far as the facts related to the opioid epidemic. I don't think a lot of people, including myself, realized how staggering these numbers are. And the purpose of writing my paper was the fact that I wanted to explore ways in which nurses could be involved in recognizing the signs and symptoms of opioid addiction or abuse, prevention of opioid dependence, and treatment options available to those who become dependent on opioids. About 21 to 29% of people who use opioids for chronic pain use are abusing them. So it is likely, unfortunately, that if you don't know someone who is abusing opioids, then you probably know someone who knows someone who does. So it is very prevalent, and it's an issue that we need to be discussing. The issue of knowing more about the signs and symptoms of opioid abuse is important because as nurses, we need to be able to recognize that in our patients, but we also need to be able to educate our patients on those signs and symptoms and educate their family members on those signs and symptoms. Those could be things like obviously changes in behavior, changes in financial situation, changes in sleep patterns, and we need to be able to educate the patient so that they can know what to look out for. If they have a family history or personal history of addiction, that's something that we need to be aware of as the nurse so that we can be more on top of monitoring those patients. It's important that nurses understand that for opioids, it is recommended to start slow and low for pain management. That means that you start at the lowest dose possible for pain control, and you also want to start with more of the quick acting opioids as opposed to the extended release opioids. So making sure that your patient is following that regime and collaborating with your physician to make sure that that is what they're doing for the patient to prevent addiction from happening as much as possible. Nurses also need to understand the recovery options for patients addicted to opioids, and it is really interesting. I found one option called peer recovery, and that is a program that they have in place in certain areas of the United States. The program is implemented in the emergency department of the hospitals. A peer recovery specialist would be immediately notified whenever someone comes in after an overdose. The reason that they chose this time right after an overdose is because it was thought that maybe this would be a call to action for the person experiencing the overdose, like that they would wake up and feel like they really were ready, they were scared, and they wanted help, and there would be someone there right at the bedside offering that help to them. The peer recovery person is someone who would also be in long-term recovery from addiction, so it would be someone that they could seek guidance from that has personal experience and hopefully make them feel a little bit more safe and not so judged, because I think that sometimes people in that position can feel sort of attacked in a way, even if it's unintentional. The reason that I chose this option as my intervention is because in the literature I found that it discussed that people often tend to gravitate towards others who have been in their same experiences. So someone like the peer recovery specialist would be someone who has experienced addiction. So I thought this would be a good option for them. And the other reason that I chose this model is because I found that one of the barriers was a lack of knowledge among healthcare providers about the options for their patients as far as recovery goes. And this option is extremely straightforward. It's available 24/7. A person comes in with an overdose, and all you have to do is call the peer recovery specialist, and they come straight to the bedside. It's very easy to implement as far as that goes. It's very straightforward. It would require very little, training. The intervention was first implemented in a hospital in New Jersey. The model has been copied and used at around 30 or so hospitals in the surrounding area. In a quarterly report that I found about the program, because there is a specific website about this program specifically that shows where it's implemented, exactly what hospitals in the area. And in a quarterly report, I found that of the 8,455 patients that were visited at the bedside post-overdose, about 646 were currently in recovery. And I was unable to find specifics about the cost of the intervention. However, I was able to find that the program included recovery specialists, patient navigators, case managers, recovery support educators. So those people would all have to be employed at the hospital, so that would be included in the cost, I guess, of implementing the program. And it would also be necessary to have some sort of a training in place to set up that program, so that would be something that would be costly as well. The implications for the nursing practice for this program, certain barriers would just be, like I said, the training. You would have to have it in place to know exactly who was calling the recovery specialists whenever the patient came in with an overdose. Otherwise, you could have instances where certain people who had come in with an overdose were overlooked, and it did discuss this on the website, and it showed that the number of calls that they were getting to come to the bedside were increasing significantly each quarter as more training was put in place for the program. This would influence patient care greatly for those who come in with an overdose. It hopefully would give them the support that they need to get into the correct program and get on the right path to recovery.